thank you for joining me today. We have been talking about endometriosis for some time. We have a playlist dedicated to different topics on endometriosis. For example, what is it, what are the symptoms, who gets it, and the medical treatment options for endometriosis. Today is a very short video, but it's looking at the surgical treatment options for endometriosis. If you haven't seen the other members or parts of the video playlist, I really recommend that you go and check them out and come back and watch this one. But if you're just interested in learning about what surgical options there are for endometriosis, then let's just dive right into it. So the surgical treatments are options that are operative procedures that are used to limit the growth or stop the growth of endometriosis tissues. So it includes ways by which the endometriosis tissues themselves can be destroyed, or the organs that have several endometriotic tissues can be removed. Now, surgery is usually used as a last resort, and we've talked about medical treatments including pain medication, hormone treatments that can actually cause a regression or cause endometriosis tissues to die. But if these measures have not been successful, then surgery can be used as an intervention, not only to get rid of the pain symptoms, but in some cases where a woman is suffering from infertility because of endometriosis, this can be a measure that can remove endometriosis tissues from organs and increase the chances for pregnancy. The surgical methods that are presently available include excision or ablation treatments, that's number one, and number two, radical surgery. And I'm going to just touch briefly about what each particular group covers next. So what do we mean by excision or ablation? In simple terms, it's just cutting away or removing something, but using different methods. And as time has progressed, there are different measures that surgeons can use to remove endometriosis deposits from organs like the ovary or like different parts of the womb where endometriosis tissue doesn't belong. And these measures have been used successfully to carry them out. In these days, excision or ablation treatments are carried out through a procedure called laparoscopy. A laparoscopy is simply where small cuts are made into the abdomen, and instruments can be passed in through those cuts to visualize the organs within the abdomen and the pelvis and carry out certain surgical interventions. It's different from laparotomy, which is where there is a cut, a larger cut made into the abdomen. For example, when a woman has a cesarean section, in order to open up the abdominal wall and see the organs and carry out any operative measure. So we're talking about laparoscopy, which is where you have little cuts made in the abdominal wall and instruments passed into the abdomen and the pelvis to be able to visualize the organs. The differences between a laparotomy and a laparoscopy also include the length of time that somebody will stay in hospital after a laparotomy tends to be longer because it is considered to be major surgery and conducted under general anesthesia, while with laparoscopy there are smaller cuts, recovery time is quicker, and people are more likely to get home sooner. There's also the reduced risk of infection, so you can see that there is some significant advantage to laparoscopy over laparotomy, even though the latter of course still has its uses in certain different conditions. Okay, we're talking about endometriosis. So what are the types of procedures that you could have through laparoscopy to treat endometriosis? One of them is called diathermy. With a diathermy tool used in a laparoscopy, it's a special electronic heated device that's used to burn off endometriosis tissues in or around an organ without causing any damage to the tissues around that organ. The second method is using laser ablation or excision of endometriotic deposits, and as the name implies, it involves using laser treatment to do the same thing, to remove endometriosis deposits from organs without damaging the tissues around. The third measure that can be used via a laparoscope is an ovarian cystectomy. So for example, if there are ovaries that have endometriotic cysts and tissues, the process of cystectomy is the removal of those cysts, and that can be carried out using a laparoscopy method. Like I said earlier, these measures can be very useful in treating infertility, presuming that the endometriosis deposits are not widespread. So let's look at the second type of surgical intervention, which are referred to as radical surgery. In radical surgery to treat endometriosis, what is done is the removal of the womb and other reproductive organs. What you have done is called a total abdominal hysterectomy and bilateral salpingo-oophorectomy. What this means is that the entire womb is removed in addition to the ovaries and the tubes, and so that's why it's called radical surgery, and usually conducted because there is widespread endometriotic deposits that it seems reasonable to actually remove the entire reproductive organs than to try and chase after every single deposit. It's usually carried out for women who have completed their families and so they're not intending to have children, because of course it's not a treatment for infertility, and it's usually one of last resort when several other measures have been sought and found to be unsuccessful to treating endometriosis. Of course, it's important to say that with surgery there is always the risk of side effects. This will be discussed with any woman at length by the surgeon, but there are things like the risk of bleeding, the risk of perforation of an organ, which can also happen with laparoscopy, even though I've already mentioned earlier that it does have certain advantages over laparotomy. But it's important to sit down with each of these methods, have a detailed discussion with your surgeon about the risks and the possible complications, so that one is aware when making a decision about taking surgery as a choice or an option for treating endometriosis. That's a brief look at the surgical options for treating endometriosis. And just like I said in the video when we were talking about how to choose a treatment option for endometriosis, it depends on a specific woman. So it's not limited to just, well, she's got endometriosis, let's do this or let's do that. It depends on the woman, it depends on her age, depends on whether the key problem is pain, whether the key problem is infertility, and these issues will determine which particular method of treatment is going to be used. So this is where we end the series for the time being on endometriosis. It's an important topic. It is quite common. Women with very painful periods or having recurring pelvic pain symptoms should be speaking to their doctors about diagnosis or considering a diagnosis of endometriosis. Like I said, we have several videos in this playlist talking about endometriosis, and I'll be happy to answer any questions or clarify any issues that you might have. Thank you for watching. Again, it's Askawayhealth, where we provide you with direction and clarity about everything medical. I'm going to put the details for our contact in the description below, and I look forward to hearing from you always. Till next time, bye bye.